So the topic is PM Atmanirbhar Swasth Bharat Yojana. Why in news? This is the first point. As far as this is concerned, a new health sector scheme, introduced in Union Budget of 2021-22. So this is the importance of this scheme. That is why we are going to discuss this scheme in our class today. Okay. And the second thing now, the next point which is important here, that about the scheme. Okay, then we will discuss other things related with this. About the scheme. So as far as about the scheme is concerned, the first and important point about this scheme that this is a centrally sponsored scheme, right? This scheme is a centrally sponsored scheme. Okay, centrally sponsored scheme. That's the point. One point, right? So centrally sponsored scheme. What is the centrally sponsored scheme? What is the difference between the central scheme and centrally sponsored scheme? That we will discuss little later in today's lecture. So next is the scheme is to develop. The scheme is to develop. Okay, is to develop capacities in healthcare system, over a period of 6 years, right? Over a period of 6 years, right? So the point is that what is the need to develop capacities in the healthcare system? The major point here we can say is that number one, the population of our country is very high. We are hosting approximately 1/6 of world's population, and the geographical of area of India, that is the 1/16 of the total land area of the world. So it means if we say that, right, for example, if we say that there are 100 units of area of the world and 100 individuals are living in the world, right? So it means we are having out of the 100, right, we are having only 6 units of land, okay? And we are hosting 16 individuals, you can say, we are holding approximately 17 individuals, 16, 17 individuals, right? So on this land. So that means what is there? Density of population is high in our country, right? Because the rest of the 83 people, right? Rest of the 83 people, right? 83 people are living on. Rest of the 83 people are living on you can say 94 units of land, right? If I take it this way, 94 units of land, right? So it means for those people, per unit of land is more than per individual availability of land. And in India, it is 6.17, which is very less. So this in itself proves that number one, density of population is high. Number two, per capita availability of resources is low. Okay. Per capita availability of resources is low or less in India. So that's there. So it means the relative standard of living in India is low. Relative standard of living in India is low. Standard of living in India is low. Okay, so that means there is relative poverty in India. Okay, there is relative poverty in India, and that means there is high probability. There is high probability of spread of communicable diseases in our country. Spread of communicable diseases in our country, right? So communicable diseases are those diseases which spread from one individual to another, right? Communicable diseases in our country, right? So that's there, and there is problem of we can say hygienic conditions also. There is problem of hygiene as well, because the crowd is there. Problem of hygiene as well. That is the point. And there is problem of you can say malnutrition in our country as well. Malnutrition in our country as well, right? Malnutrition in our country, right? And the problem of undernutrition, particularly among the children, that is there. Undernutrition, particularly among the children, prevails there in our country. Particularly among children prevails there in our country due to the prevalence of poverty, right? Due to the prevalence of poverty and low standard of living. Okay, so we do have the food problem also, right? Due to the prevalence of poverty in the country. So this is the issue on the one side, right? And the next important thing is that right, in the age of transition today, transition today, stress is increasing. Stress is increasing. Mental stress is increasing, right? Due to which the mental health of people is also being affected, right? Is also being affected. And the next is that in India we are having two you can say particular categories, right? Two particular categories of population with the striking differences, right? With the striking difference, that is, one is the affluent group of society, right? And second is the poor group in society, right? Affluent group and the group of poor people in society, right? And you can say, as far as the affluent group is concerned, in those people, it is quite visible that they are suffering from the lifestyle diseases, right? Lifestyle diseases means diseases like diabetes, diseases like obesity. Obesity is also a problem in itself, right? So heart related diseases, right? And such type of diseases, right? And the poor are suffering from the mental illness, right? Mental illness. So that's there. Okay. So mental illness does not mean that they are, you can say, right, behave like the pagals or like that. है ना? पागलों की तरह behave करना नहीं होता. It means their mental health is not sound, right, as it should be. Okay. So that is the another point here. Okay. So these are the various things, right? And the next thing is that I am moving on to the next slide. Can I? Okay. And the next point is that, okay. So, and the next thing is that due to the geographical location of our country, geographical location of India, Swasth means healthy. Due to the geographical location of India, right, and the you can say use of high quantity of fossil fuels, including coal, right? The pollution related issues are very high in India, right? The pollution is very high in our country, So this is also one of the reasons, right? So in some countries, there is, in some cities, there is the concentration of the industry and there is very high automobile emission also, right? And in the northern India, right, due to the geographical factors over there, the pollution remains very high, right? And there are some other factors, right? So let us discuss this, that why pollution in our country remains so high, right? So there are two factors. One is the natural factors and second is the anthropogenic factors. Anthropogenic means man-made factors are there. So as far as the natural factors are concerned, there are two important points here. Number one, which is there, that a lot of alluvial soil in our country, lot of alluvial soil in India, right? So the particles of alluvial soil remain loose. That's why air carries, okay, more particles of alluvial soil, right? So therefore, the concentration of dust particle of air remains higher in India. Okay, so one point is that, which is an important point. And the second thing is that the northern part of India is blocked. Northern part of India is blocked by Himalayas, right? Which doesn't allow air to pass or cross, right? Air to cross, and it becomes a hindrance in the spread of dust-bearing air, right? Dust-bearing air towards northern part, and that is why concentration of dust particles remains high over India. Concentration of dust particles remains high over India. These are the two very important reasons, right? So please bear this in mind. And the next thing is that, next thing we can say that India falls in tropical and subtropical zone. Tropical and subtropical zone, right? So due to which, right, there is a high prevalence of heat, right? So this causes the soil to become dry. This causes the soil to become dry, which becomes more vulnerable to erosion by air. Okay, to erosion by air. So this is the next point, right? Vulnerable to erosion by air. So these are some points that why the pollution in India remains high. Okay. So as far as the various anthropogenic causes are concerned, right, we can say one point is that there is high population in India. Population level is very high. One point is that, right? And due to the high population, so there is a, right, there is, you can say, more movement of people, right? More movement of people. Transportation activities, okay, transportation is higher, right, is higher, and due to which, right, transportation is higher, and need of more housing facilities, right, need of more housing facilities, okay, housing facilities, etc., and destruction of forests, right, due to fulfill the needs of the population or to construct the houses, etc., right, and this leads to, right, so all these things increase the vulnerability of soil erosion, okay, soil erosion by wind, right, soil erosion by air or by wind, you can say, right. So this is one of the reasons, okay. And the second reason is that India is mainly agriculture dominated economy, right, agriculture dominated economy, right, and agriculture is the main occupation of people in India, main occupation of people in India, right. So more cultivation leads to okay, leads to right, loosen the leads to loosen the soil particles, right, which become more vulnerable to erosion, okay, more vulnerable to erosion. Okay, so this is the next reason we can say, right. And next point is that low level of development of Indian economy, low level of development of Indian economy, right. So due to the low level of development of Indian economy, So we need to develop the infrastructure in our country, right? Develop the infrastructure in our country, right? The point is that, and for that purpose, right, we need to burn, we need more energy, we can say, right? We need more energy, more electricity, right? And to fulfill the need of more energy, right, we are mainly depending on the consumption of or depending on the fossil fuels, we can say, right? Fossil fuels which are comparatively, right, which are comparatively more or more polluting, you can say, right? More polluting. That is the point, right? We depend on coal, we depend on diesel, we depend on petroleum, etc., etc. So which are relatively more polluting, you can say, elements, right? So, and moreover, the next thing is that, right? So our industry is also based on, right? Our industry is also based on sources of cheaper energy, because costlier energy, right? Because costlier energy would lead to increase in cost of production, and due to which Indian industry would not remain competitive in the world. Indian industry would not remain competitive in the world. Okay, competitive in the world. So this is also one of the anthropogenic reason, that why, right? This is the reason, right? And the next point we can say that lack of awareness and education is also one of the points, right? Lack of awareness and education, right? Due to which, right? Due to which the individuals, right? A particular section of people in India, we can say, right? Right? Do not bother about the pollution causing activities, right? Do not bother about the pollution causing activities. So that is also one of the points. Okay, pollution causing activities. That is also one of the points, right? So is this slide clear? Have you noted the points down? I think if the question is asked on, you can say air pollution in India. Sorry, let's suppose you can say essay is there, right? So I think the whole of the essay we have discussed so far. So you have to write only 1000 or 1200 words. No? So the next, right? So the next most important point of high pollution in India, right? That is the one of the major points, that is the paddy burning. Okay, paddy straw burning, right? Paddy straw burning. So that is the major important, which is a very important issue, right? So the government was about to enact a bill, right? That fine of ₹1 crore to the farmers who will burn paddy straw in their field. So the point is that, so why do farmers burn paddy, right? Number one, we can say paddy cultivation is higher in India. This is the one point. In northern Indian states also, Punjab, Haryana, UP, and the southern states also, paddy cultivation is quite higher in India. This is one. This is the point. What's the reason? Fossil fuel raise and low. I don't get your point. Fossil fuel raise and low. Please clear your point. So I'm talking about that, right? Paddy cultivation is higher in India, right? And the point is that there are two reasons, because paddy straw, okay, has more content of silica. So this is one most important point. Please bear this in mind. This can be asked you in your examinations also, for the preliminary examination particularly. Right? Paddy straw has more content of silica, right? And right, due to this reason, right, if the farmers, right, so cultivate it, right, into the field, okay, without burning, it takes very long time, right? It takes very long time, right? You can say for its, okay, for the composite forming, for the composite formation, right? Means इसकी जो degradation है, it takes very long time because of the silica content in it, and silica resists that. Okay, so that's a good point which you should bear in mind. Okay, so that's an important point, please. So this is the point. One point is that. Okay, and the second point, if I would take here, so if the farmers, right, if the farmers, okay, go for, right, it's a, right, go for its treatment, otherwise, right, it increases the cost burden on farmers. It increases the cost burden on farmers. So that's one point, right? So, right, means if they try to cultivate it again and again, right? So that it may be cut into smaller pieces, right? And it may mix into soil. So that may take time, right? So that's the point, right? And the second thing is that, right, there is a lack of proper technology in India. Okay, proper technology in India to deal with this issue, right? To deal with this issue, we don't have technology that how to, right, deal with this problem, right? How farmers can deal with this problem. We don't have adequate technology so far, and farmers are not financially sound even. So that is also the problem, right? And next thing is that another alternative where the paddy straw or the paddy waste can be utilized, right? That is the, you can say, biofuel energy generating units, right? Biofuel based energy generating or energy production units, right? Energy generating units, right? So it can be put there, it can be used there. Okay, but so far we are lacking the biofuel based energy generation units also, right? We are lacking those. Okay, we are lacking those. So this is the reason that why the problem of paddy burning exists there, right? So is it okay, right? And we can say that if the pollution level is high, because we are coming on the health again, right? So if the pollution level is high, right? So there is a more, right? You can say burden of respiratory diseases, right? Respiratory diseases, right? Among the on the people, right? More burden of respiratory diseases on the people. So that is also one of the reasons, right? More burden of respiratory diseases. Okay, so this is the previous slide. You want to see it, please see it. Kindly tell me when it is complete. Okay, so right. So now the next slide we were discussing, if the pollution is high, there is more burden of respiratory diseases on people, right? So it means so far we have concluded that, right? And one more thing, yes, so far we have concluded that, right, in India, right, there is a high prevalence of diseases. Okay, high prevalence of diseases, right? Diseases. What type of diseases? Communicable diseases, right? Communicable diseases. Risk is very high. Risk remains high because population density is very high there. One is that, right? Lifestyle related diseases. Lifestyle related diseases. Okay. And immune system related diseases, because immune system is low due to the nutrition issues. Immune system related diseases, right? Diseases among children, right? Diseases among children due to the prevalence of malnutrition in the country, sorry, undernutrition in the country. Mental health related issues are very high. Mental health related issues are very high, right? High population density and poor road infrastructure and poor rail safety measures, right? Number of accidents is very high in our country. Number of accidents is high, right? Industrial accidents as well as the road accidents also. Number of accidents is very high. And the next thing is that, right, vector-borne diseases risk is also high, right? Because we are in the warm zone, right? We can say, right? So subtropical, tropical and subtropical zone, we are living there, warm zone, and monsoon is there, right? So vector-borne diseases is also very high there, right? And apart from that, burden of the conventional diseases is high, right? Conventional diseases is high. Right? So some are new diseases, some are conventional diseases, some are communicable diseases, right? Some are vector-borne diseases, some are immunity-related diseases, some are lifestyle-related diseases. So that is there, right? Vector-borne diseases, those diseases which are spread from one individual to another, right, by some vector, right, that carries the virus from one person to another, right? Like mosquito is a vector, okay? It spreads malaria. So that's the vector-borne disease. So this is the point, right? Is it clear? And and you can say on one side, this is the issue, right? This is the issue. And on the, we can say, other side, right? On the other side, lifestyle related diseases, the diseases which are related with your lifestyle, like, right, you can say less exercise, more stress, more mental work, mental load, right? And we can say, right, lack of discipline in your, you can say, eating behavior, right? So eating of the unhealthy food, junk food, etc., etc. Due to that, a number of problems are there, right? Obesity is a lifestyle related disease. Diabetes is a lifestyle related disease, the type 2 diabetes, right? And similarly, that this heart related issues, right? High blood pressure, that is a lifestyle related disease, right? So there are a number of diseases of such type, right? Which are the diseases of the new era, right? So this is there. So and on the other side, right? Number one, right? Doctor patient ratio, okay? Doctor patient ratio is very low in our country. Doctor patient ratio is very low in our country, right? One point is that. Number two, right? Patient and hospital bed ratio is very high. That means lack of the bed facilities in the hospital is there, right? Patients have to wait, right? So that is the problem. And then lack of the right paramedical staff also, right? Lack of paramedical staff also, okay? Lack of other health infrastructure in the country. Okay? And improper health facilities in the region, in the rural, health facilities in the rural, right? You can add some statistics also with these things, okay? So statistics are available everywhere. Improper health facilities in the rural sector, okay? Health facilities in the rural sector, okay? So these are the various things, various issues, right? So due to which we can say that as compared with the risk, as compared with the burden of diseases, right? So our capacity to deal with those diseases is quite low as on today, right? Our capacity to deal with those diseases is quite low in our country. And therefore, there is need to enhance the capacity of the country in the health sector in the days to come, right? Because health, education, these are the two fundamental sectors of the economy, of the society, right? So the future of the society depends on two basic things. One is the health, second is the education, right? So that's why health needs to be focused, right? Because if you are not healthy, the per capita productivity will be low. If per capita productivity will be low, people would be earning less. If they would be earning less, they would be they would be not able to, they would not be able to, right, raise their standard of living. Poverty will be there and they will fall in the illness again. So this is the cycle, right? Poverty brings poor health. Poor health brings low productivity. Low productivity brings poverty. Okay, this is the one point. And second thing is that the capacity of the nation would also be low, because capacity of the nation is sum total of the capacity of citizens, of individuals, right? So it means that would lead to fall in the gross domestic product of the country, right? And disease burden would become high, right? And due to that, the other areas of development would start suffering and the future would become dark, right? So you people, right? India has very high hopes on you people, on the generation to come, right? And if that generation which is coming next to lead the country, right? So that generation, you can say, would, right? If that generation is not healthy, so that generation would become a liability on the country instead of the asset of the country. Okay, so the children who are stunted today, right? The children who are waste children, right? So it means they may become liability on the country in the days to come, right? So that is why we need to take proper care of these things so that the health of the people should not suffer in the country, right? Should suffer the least, right? Impossible, which is there. So should suffer only to that level, right? And beyond that, we should control it so that it would help for the economy to become stronger, right? It would help for the country to grow. It would help for the country to, you can say, develop also. Okay. So this is the reason. So the point is clear now. The point is clear. Okay. So these are the various things that why we need to increase the capacity, right, of the health sector. That's there. That's why Kejri is good. Acha, okay, Kejriwal you are talking. Okay, and now because there are further two important points, right? When we talk about the health, right? So there are two important things. Right? So one thing is the remedy, right? Remedy, cure, treatment, which is there, right? In remedy, what is there? Cure and treatment. That is the remedy, right? Cure and treatment, right? Means you got ill, right? And there are the hospitals. You go to that hospital, right? They would treat you. They would cure your disease, and you will become okay, right? And second thing is the prevention. Prevention, okay? Prevention, right? Prevention means to keep the people healthy, right? To prevent those, right, falling ill. Okay, so that is the prevention, right? So whatever the polio vaccination we are doing, that is a preventive measure, that is not a remedial measure. Okay, so that the children should not suffer from polio in our country, right? And whatever this corona vaccine is nowadays, that is also a preventive measure so that the other people, right, should not be affected from the this coronavirus, right? So these are the preventive measures. A number of right BCG injections are given to the children, right? So such type of number of preventive measures the government is taking, and similarly yoga, that is one part of that, right? And health and wellness centers which are being opened by the government in different parts of the country, right? So that is preventive measures, right? So we can say uh, to focus on the health sector, to keep the people healthy, right? There are two important strategies, right? One strategy is to prevent them from falling ill as far as possible. And the second strategy is proper care of those who fall ill. There are two important points, two important strategies, right? So prevention is better than cure, right? So हम school level में ये पढ़ते थे, है ना? Prevention is better than cure, right? तो तब हमें कम ही समझ आती थी कि इसका क्या मतलब है. So that's there. So that's why these are the things, right? So I think it is justified that why the government has brought this scheme, which we are discussing today, right? PM Atmanirbhar, right? Swasth Bharat Yojana, right? So PM Atmanirbhar Swasth Bharat Yojana is a new scheme introduced in this budget of 2021-22. This is a centrally sponsored scheme, right? And the main objective of this scheme is to increase the capacity of India in the, we can say, health sector, right? To develop the healthcare system of the country, right? Over a period of 6 years, right? So major takeaways as far as this scheme is concerned now from your examination point of view, right? So our scheme is PM, right? Atmanirbhar, okay? Atmanirbhar Swasth Bharat Yojana. Swasth Bharat Yojana, right? So for your examination, what is important to remember? So far, what we have discussed, one point which is important to remember, that introduced in budget, okay, 2021-22. These are the facts for your preliminary examination, which you should. Atmanirbhar, self-reliant. Bharat means India. Yojana means scheme. Okay, Bharat is the name of your country. You should know this. Though you are from South India, but still you should know that what is Bharat. So introduced in budget 2021-22, right? One is this. Second is that it is a central sector scheme. Okay, it is a central sector scheme. This is the point. Kevis, I am just allowing you to speak. Yes, please tell me. What's your query?
What is Yojana in English?
Yojana means scheme. Scheme. S-C-H-E-M-E. Scheme. Okay? Hello? Is it clear? Let me write here.
Okay.
Yojana means scheme. S-C-H-E-M-E. Scheme. Okay? So in English, you can say PM self-reliant, right? Healthy India scheme. PM self-reliant healthy India scheme. Okay, so in English, you can write it that way to have a understanding of this. Okay, so now it is a central sector scheme, right? And the third important thing in this is that its main objective is to enhance the capacity of healthcare system in India. Okay, capacity of healthcare system in India. So far we have discussed this also. And the fourth point, which so far we have discussed, that is, this is a scheme for 6 years. Okay, so this is a scheme for 6 years so far, right? In future, we don't know whether they will extend it or not. why scheme names are in Hindi, not in English? What can I say, beta? Right? This depends on the government, right, which you have elected. Okay, so there is no other reason. Okay, so and you people of Tamil Nadu, I think this time going to elect the same government which is there in the center or not. So this is the reason, right? So I don't know what's your opinion. Okay, so this is the reason, right? Hindi is our national language, not a problem, right? And even R, right? And even R, you can say this you can say, right? English is also used, right, as an official language in our country, right? Even the parliament, right? Even in the parliament of the country, we use the English language, right? And even in the Supreme Courts, High Courts, right? Entire judicial system, we use English language, right? So it all depends, right? So leave this question that why not Hindi name, why English name? So this is not a question for you. So far we have taken away these 4 points, right? These 4 major takeaways from this. Okay. So now the next thing is that on the next slide I am moving, right? Let me note it here only. Then there is the aims of the scheme. Aims of the scheme. What are the major aims of the scheme? As far as the aims of the scheme are concerned, one aim is to improve primary, secondary, and tertiary. Okay, and tertiary. We can say healthcare systems in the country. Healthcare systems in the country. Okay? So one aim is this, that primary healthcare system, secondary healthcare system, and tertiary healthcare system, we have to improve those. What are the primary, secondary, and tertiary healthcare systems? We will discuss later in today's lecture. Okay, because many of the students won't be knowing that what is the difference between primary, secondary, and tertiary sectors. Right? Honestly, tell me, how many people know about it? Honestly, tell me. If there is, let's suppose you are sitting in examination or you are facing an interview, they ask you that what is the striking difference between the between the primary, secondary, and the tertiary healthcare. So what will be your answer? Do you know it properly? I know that everybody will know, right? That primary means primary, basic. Secondary means of the second level. Tertiary means of the third level. Okay. So, but to explain, you don't know that what is this. Huh? Am I true? Am I true? Okay. No problem. We will discuss it today, right? After today, this will be clear to you. And second is the strengthening. Okay, strengthening existing institutions in healthcare. Strengthening existing institutions in healthcare. Okay, existing institutions in healthcare. This is the second point. And third point is that creating new institutions, right? Creating new institutions, right? To cater to, you can say, right? To cater to direction and to cater to direction. Okay. Cater to direction. One second, direction is wrong. Cater to protection and cure of. Cater to protection and cure of new and emerging diseases. New and emerging diseases, right? Like corona. New and emerging diseases or new diseases which are coming due to the environmental changes, right? Due to the exposure of the human to the you can say wildlife, right? More and more, because the forests are being cut, right? And so there are many reasons, right? Because and the world is becoming a global village now, right? We are coming in contact with each other. That is why African diseases may come into India. Indian diseases may shift to Africa also, right? So such type of problems are there, right? So these are the three important things, right? One is that is the three sectors of healthcare to improve those. Okay, one is that. Second is the existing institutions in healthcare. And third is setting up new institutions to cure and protection of the new and emerging diseases in the country, right? So aims are quite easy to remember, I think. There is no big thing, right? One is the three sectors. Second is to strengthen the existing institutions in healthcare. And third is to create new institutions to cater to protection and cure of the new and emerging diseases. These are the only 3 points here, right, which are important to note, right? Okay, so, right. So now let us move further. So this is about the aim, right? So with aim, the next point, which is the duration, that I have already told you, that the duration of the scheme is 6 years only. Okay. So one point is this, right? Next is that important features of the scheme, right? So then we will move on to discuss other things. Important features of the scheme. Okay. Important features of the scheme. So as far as important features of the scheme is concerned, one is the, let us say that the scheme will support, right? Support in setting up of, scheme will support in setting up of, right? What is number one? In setting up of, number one, rural urban health and wellness centers, right? Rural urban health and wellness centers. Okay, health and wellness centers. So one point is that. Okay, rural urban health and wellness centers. One is that. We'll discuss central sector scheme. Okay, we'll discuss after this point. So here is the second point, rural urban health and wellness centers. Second is the integrated, okay, integrated, we can say public health labs, integrated public health labs, okay, integrated public health labs, that is there. And the third point is that critical health care, right? Critical health care, we can say hospital blocks, critical health care hospital blocks, right? So critical diseases or critical issues, right, means the persons, right, who are suffering from the life-threatening diseases or accidents, right? So they need the critical care. Okay. So critical healthcare blocks, hospital blocks means there will be separate blocks in the hospitals, right, for those people who are suffering from the life-threatening diseases or life-threatening accidents. Okay. So this is the point. So I will come to all these things later on. And the next point is that National Institution for One Health, right? This is very much important point. I will discuss later in today's lecture. National Institution for One Health. Okay. Institution for One Health. This is an important point. We'll discuss it later on in our lecture today. And the next thing is that a regional research platform uh, regional research platform for WHO, right? Southeast WHO, Southeast Asia, right? Southeast Asia means we will develop in India a regional research platform for World Health Organization, Southeast Asia region, right? So that's there. Okay. And the next point is that establishment of 9 biosafety, level 3, okay, laboratories, bio 3 laboratories, okay, and four, right, regional centers of National Institute of Virology. 4 regional centers of National Institute of Virology. Okay, National Institute of Virology is an important and very important, in fact, institute of India, right? So it is located in Maharashtra, in Pune, right? National Institute of Virology, that is there. And the next point is that, 7th point is that is the strengthening National Center for Disease Control, right? Strengthening of National Center for Disease Control. Okay, National Center for Disease Control, that is NCDC, right? NCDC, and 5 regional centers of it. Okay, and 5 regional centers of it. Regional centers of it. Okay, so that's the next point, right? And next is that expanding the 8th point. That is, we can say that expanding the integrated health information panel. Integrated health information panel. Okay, so these are the points there. Virology, virus related studies. Okay. So this is there. Okay, so now these are the important features of the scheme, right? So let us revise these ones. Number 1, wellness centers to set up, right, in various parts of the country. Number 2, integrated public health labs to develop. Number 3, critical healthcare hospital blocks to be developed. Number 4, National Institute of One Health. Number 5, regional research platform for WHO Southeast Asia. Number 6, establishment of 9 biosafety level 3 laboratories and 4 regional centers of National Institute of Virology. And number 7, strengthening of National Center for Disease Control and 5 regional centers of it. And number 8, expanding the integrated health information panel. Okay. So now the one question I'm giving you, right? So you need to try that question. Okay. So the question is that a new scheme, right, in health sector, okay, in health sector, PM Atmanirbhar Swasth Bharat scheme is introduced in India through the budget of 20, 21, 22, right? Do you think this scheme would be sufficient to address the various issues of health sector in India? Various issues of health sector in India, right? Various issues of health sector in India, right? Or you can say, do you think this scheme will be sufficient, right, to make India healthy, right? Let us change it. Let us make it like this, to make India healthy, right? Because that would be quite broader, to make India healthy. So this is the question, right? You need to try. Okay. So in this question, what is there? So whether this scheme would keep India healthy or not. Okay. So this is the point, right? Give me just 1 minute. I'm coming back. Okay. Please don't go away. Till then you think on this question. Okay? Okay. So I am back. Hope you all are there. Okay. Somebody is raising hand. I am allowing you to speak. Please tell me, what is your question? ARP, what's your question? Okay. So I gave you this question today, that a new scheme in the health sector, PM Atmanirbhar Swasth Bharat scheme, is introduced in India through the budget of 2021-22. Do you think this scheme would be sufficient to make India healthy? Okay. So now the point is that. So I would expect that you would try to write the answer to this question, right? I would expect. So now the one more question, right? Let's suppose this question is there. Statement 1, right? So in 2021-22 budget, right, India introduced PM Atmanirbhar Swasth Bharat scheme or Yojana, right? Swasth Bharat Yojana, right? Number two, India is not India does lack right health related facilities in India. India does lack health related facilities. So these are the two statements, let's suppose, right? Okay, so this is your CSAT paper, let's suppose, right? These are the two statements which are given there. And here are the codes, right? One point is that, okay, one point is that you can say statement 1 has no relation with statement 2. With statement 2. Number 2, okay. Number 2, right? Answer choices हैं यहाँ पर. Answer choices you can say. Right? Number 2, statement 2, statement 1 is an outcome of statement 2, right? Statement 1 is an outcome of statement 2. Number 3, right? Number 3, you can say that number 3, statement, right? Statement 1, okay, statement 1 leads to the conclusion which is given in statement 2, okay, statement 2. And number 4, none of these, okay, none of these, right? You try this question also, okay, you try this question also. This is for your reasoning paper question, okay, question for your reasoning paper. You try this question also, right? And this is for your mains paper question, the first question which is given there. Okay, so this is there, right? So it's given. So now the next question is, let's suppose, which can be there for your preliminary examination, right? So which of the following statements about PM Atmanirbhar Swasth Bharat Yojana are not true? Are not true. Okay. Number one. Okay, I'm just showing. Is it done? Ripavita, tell me. Okay. So Number one, the main focus of the scheme is on prevention than cure. Main focus of the scheme is on prevention than cure. Number two, the scheme is to improve India's healthcare system in the coming 5 years. Second is this. Okay, and the third point is that the scheme is the first step in health sector after grown out a government commitment to enhance the health capacity of the country. Bottom top approach, the scheme will be economy, infra system, vibrant demography and demand. The scheme will show that government is serious about the steps needed to reach that level of health preparations to reach last mile of our nation. The scheme is health sector still less than target of 2.5% of GDP. Okay, you have written the answer to that question, I think, but not this way, right? Because in chat box, I would not be able to, you can say, comment on your answer properly, right? So the next is, you can say, the scheme, right? The scheme has brought a unique concept of national, right? National institution for One Health. National Institution for One Health, right? For the first time in India. Right? And number four is that, right, the scheme, right, the scheme involves the community participation in healthcare management of the country. So these are the various points which have been written here, right, from the examination point of view. And we need to find that which of the above statements are incorrect, right? So that's the point, right? So first option, okay, that is the one only. And second option, let us take, you can see, 2 and 4 only. And third option, let us take, that is 1, 3 and 4 only. Okay, and the fourth option, that is all of the above. Tell me what can be the answer. Okay. Okay. Bhavesh C, Nishank D. Okay. Second. Nishank, is that third statement wrong? Do you think? On what ground it is wrong? Okay. So far, majority answer B, 2 and 4. Okay. B, B, B. Okay. Okay. Right. Good, good, good. You are answering good. That's important. पहले भी आप पढ़ाए हैं. Okay. रविराज D, आशिका B, गीता B, संतोष C. Right. I think we don't have discussed this scheme, Nishank, earlier, because this is the first time I am discussing the scheme, because after budget, this is the first time I am taking this class. Okay. So one thing is that beta, right? Okay. Yes, Nishank, I am just. Yes, tell me, Nishank.
सर वो मैं उसको बोल रहा हूँ सर, नेशनल इंस्टीट्यूशन फॉर वन हेल्थ.
ओके ओके. ये पहले हमने किया है कभी?
तो सुना सुना लग रहा है, शायद आपने पढ़ा है कभी.
हो सकता है. चलो कोई बात नहीं. So now beta, this is C. Now there is the first statement. The main focus of the scheme is on prevention than cure. कहीं पे ऐसी बात हुई है? पूरी स्कीम हमने की है. हमने बोला है कि हमने right, we are to increase the health care system in the country. One is that, right? We are to improve the primary, secondary, and the tertiary health care also, right? So secondary and tertiary health care, when it comes into the question, then it means the sick people only, right? That is there, right? And then next we have told that there is a, you can say this critical health care hospitals, right? So that point comes only after the disease occurs. And then we have talked about the, that you can say that establishment of biosafety levels, etc., right? So all these things are not related with the prevention, these are related with the cure. So it is wrong to say that scheme's main focus is on prevention than cure. This is wrong to say. Okay, so this statement is wrong, obviously. The second statement, the scheme is to improve India's healthcare system in the coming 5 years. No, it's 6-year scheme. This is wrong. Clear? It's 6-year scheme. So this is wrong. Next is the scheme has brought a unique concept of National Health Institution for One Health for first time in India. This is wrong because it is already under construction in Maharashtra. We will discuss today. Next is the scheme involves the community participation in healthcare management of the country. It is also not mentioned anywhere. So it means all of the above statements are wrong. Okay. Okay. So very, you can say, right, very much keen, you can say, observation is required to handle such type of questions. Okay. So keen observation is required. So this is the thing so far we have discussed, right? So, and where you can commit mistake in your examination, that also we have brought into focus here. Okay? So never commit such type of mistakes, right? For those things, right? You have to exercise a lot of questions, right? So we will start that also, but later on. फर्स्ट एक आपका लेवल बन जाए, उसके बाद हम स्टार्ट करेंगे अपने क्वेश्चन प्रैक्टिस भी. ओके, डोंट वरी. एंड द नेक्स्ट थिंग, नाउ नेक्स्ट पार्ट ऑफ द लेक्चर which I am starting, right? So that is the first thing which was there, that it is a centrally sponsored scheme, right? So it means there are two types of schemes which are announced by the union government in our country. One type of scheme is the central sector scheme. Sector schemes. Okay, and the other type of schemes are, we can say, those are the centrally sponsored schemes. Okay, so two types of schemes can be there. Central sector scheme and centrally sponsored schemes can be there, right? So as far as the centrally sponsored scheme is concerned, right? So centrally sponsored schemes are mainly there to support the states in their development efforts. Okay, centrally sponsored schemes are mainly there to support the states in their development related efforts. Okay, in their development related efforts, one is that. Number two, these schemes are financed by center and state both. By center and state both. It means part of the funds are contributed by center and part of the funds are contributed by state in such type of schemes, right? So now, as far as the central share is concerned, right? So in the case of central share, let me talk about the central share and central share, and the other is the state's share, we can say, right? Other is the state's share, central share and state share, right? So as far as this we can say central share is concerned, first of all, let me tell you that in hilly regions, okay, hilly regions, Northeast India, okay, in hilly regions, Northeast, right, and mostly in tribal states, right, in tribal regions, right, or those states where the tribal population is very high. In such states, so mostly the center contributes 90% and state has to contribute 10% in such schemes. Mostly, this is general rule, right? And in other states, in case of other states, right, the fund sharing ratio mostly remains 60-40, right? 60% has to be contributed by the state, and the 40%, sorry, 60% contributed by center and 40% contributed by state. But in some cases, right, it may be 80-20 also, right? In some cases, it may be 80-20 also. So this is about the, right, which I have told you that these are financed jointly by center and state. So that is there. Okay. So this is the point there. So the next thing is that about the, you can say this centrally sponsored schemes, sorry, about the central schemes, central sector schemes are concerned. These schemes are fully funded by the center, right? These schemes are fully funded by the center. Okay, fully funded by the center. So this is the main difference between the schemes, right? Fully funded by the center. This is the main difference now. I hope it's clear to you. There was one question from some student. I think Nishant raised this question that central sector scheme क्या होती है? Sorry, central sponsored scheme क्या होती है, right? So this is the main point of difference between these schemes, okay? So now the next point, which we are going to discuss now, that is in the previous lecture, we have discussed about that the new scheme is about to improve the primary, secondary and tertiary healthcare system of the country. So now we are discussing about the primary, secondary, and tertiary healthcare. Okay, primary, secondary, and tertiary healthcare. So this is the point which is important to be discussed here. Primary, secondary, and tertiary healthcare in the country. Okay, so this is the point. So now the thing is that first of all, we will discuss that what primary healthcare is. Okay, this is the first important point, that what primary healthcare is. What primary healthcare is. So as regards the primary healthcare is concerned, we can say, okay, so this is the first level of contact between the, it is important to note, this is the first level of contact between the patient or his family members, right, with the health system. Okay, with the health system. So one point is that, with the health system, one point is that, right? Basically, whatever the small dispensaries in your villages are, right? So whatever those, you can say, small facilities where you will find only one doctor appointed, there is no specialist appointed there, right? So that is part of the primary health center. Okay, because there is no facility of the specialists, you can say, right? There is only one doctor, right, who deals with the patients. Patients go there, that doctor checks up the patient, right, and he suggests them that where he needs to go, right, and if the disease is of general nature, then that doctor cures him, right? But if the disease needs the attention of the specialist, right, so then the doctor refer him to the secondary healthcare center. Okay, so this is the system basically, right? Okay, yes, like your mohalla clinics in Delhi, or like that, right? Dispensaries in the villages, right, where only one doctor is appointed, right? And whether a patient is suffering from the heart disease, whether a patient, right, is suffering from the that you can say, right, paralysis, etc., right? So all those patients visit there, to the same doctor, right? So then that doctor recommends them that you can say where to go, right? Okay, you have the problem related with the heart, right? So that is why you need to consult the, right, you can say that the right, so heart specialist, or you need to go with some right, you can say gastro specialist, right, or whether you need to go to some nephrologist, or some psychologist, or whatever it is, right? So that is basically the primary health, right? So the next thing is that this point is very much important, which I'm telling you now, right? According to, right, we can say, right, Alma-Ata, right, according to Alma-Ata Declaration of 1978, according to Alma-Ata Declaration of 1978, right, primary healthcare includes. So what is included there into the primary healthcare? This is important, right? Primary healthcare includes, first thing, number one, care for mother and child. Care for mother and child, one. Second thing which is there, that is the family planning. Okay, family planning. And third point is that is the immunization which it includes, right? And the fourth point which it includes, that is, we can say prevention of locally endemic disease. Okay, prevention of locally endemic disease, right? Locally endemic disease. Okay, and then number 5, it is the treatment of common diseases or injuries, right? Treatment of common diseases or injuries Okay, so this is the point. And next is the provision for health education. Provision for health education. Okay, and the next point is that provision of food and nutrition. Provision of food and nutrition. Okay, and the next point is that, right, we can say adequate supply of safe drinking water. Adequate supply of safe drinking water. Okay, so all this comes in the definition of the primary health according to that, right, Alma-Ata Declaration. So this very important point, right? So if the question is that, right, what is the primary healthcare system of India, right? And what are the problems related with the primary healthcare system in our country, right? So this is where this will be very general question if the question comes on that, right? And the question can be asked in that sense also, right? That give suggestions, okay, give suggestions to make India healthier, right? So if that is the question, in that question also, you need to focus more on the primary health care, okay? Because primary health care is more important. So you reach the secondary health care when you fall ill, right? But as far as the prevention is concerned, right, as far as the foundation is concerned, that lies here, because adequate supply of safe drinking water, right? So if the adequate safe drinking water is supplied to you, then you can say a number of diseases, right? You will avoid from a number of diseases, right? Which are waterborne diseases, right? And provision of food and nutrition, right? If good food and nutrition is available to you, then your immune system will remain stronger, right? And it will fight itself with a number of diseases, right? And that is there. You will be less prone to diseases even. So that's also important point, right? And the next important point is that provision of health education, right? If you have better health education, you can manage your health well, right? And you can avoid a number of diseases, right? Which are the result of your negligence, right? So that's there. And apart from that, right, immunization, if the proper immunization takes place, then many of the diseases, right, are there from which you can avoid, right? Right, so which can be avoided. And the next point is that is the family planning. That is also important, right? So as far as the family planning is concerned, right, so it means a small family, right? If there is small family, that means better care, right? Better food, right? Better environment, right? So that helps in keeping healthy, right? So good health of mother also, if the family size is small, right? So next is care for mother and child, right? So this is very much important thing, right? Because care for the child at the time of the birth is very much important, right? If the child is not given the proper care at the time of the birth, then he or she, right, may be affected by some problems, right, which may you can say, right, remain with him, which may accompany him throughout his life, right? So that is why, and moreover, infant mortality rate, right, that is very high in our country, right? So that it can also be reduced by the proper care of child, right? Maternal mortality rate is also very high in our country, right? So that can also be reduced by this proper health care, right? So it means primary health care is the fundamental thing. Primary health care is very basic thing, which is very much important, right? So if the primary health care is quite stronger, is quite efficient, is quite effective, right, then the need for secondary and tertiary health care, right, reduces automatically. Okay, so that is why if there is the such type of question that gives suggestions to make India healthy, right, make India healthier, so then main focus on primary, right, and then budget, health budget should also be increased, right? So let's suppose the question is asked that okay, the question is asked that give suggestions, right, give suggestions to make India healthier, okay, to make India healthier, right? So what will be there? Mean one is the primary health care, okay, primary health care should be focused on, right? So here you need to explain it that what I mean by the primary health care, right? So that should also be explained there, okay. Number two, right, so health education, okay, health education should be made, okay, part of school curriculum, okay, part of school curriculum. This is the next thing, right? This is the next thing, right? And third point is that better hygienic conditions, right? Better hygiene, right? Better hygiene, right? Like we can say that Swasth Bharat India, you can give the example of that, all right? That is there, okay? And the next point is there, all right? So promotion of sports activities, right, to keep the youth healthy, okay, promotion of sports activities to keep the youth healthy, okay. Next is right, so you can say delivery of or one second, inclusive development of the, right, inclusive development of the healthcare system of the country so that it may reach everybody, right, it may healthcare system in the country so that it may reach everybody, okay. So these are the various things, बस आप ऐसी चीजें लोगे तो आपका एक क्वेश्चन कंप्लीट हो जाता है ना? कुछ भी नहीं होता, you need to write how many words, hardly 150 and 200 words, right? So how many words are there? 1 2 3 4 5 6 7 8 9 10 11 12 13 14 15 16 17 18 19 20 1 2 3 4 5 6 7 8 9 10 11 12, it means 42 are there, right? So 50 words तो मैंने लिख भी दिए है ना, तो अभी आपने इन, राइट, अभी आपने इन वर्ड्स की एक्सप्लेनेशन लिखनी है तो हो जाएगा आपका 150-200 वर्ड बड़े आराम से, है ना? कंटेंट शुड बी सॉलिड, राइट, एंड कंटेंट शुड बी वेरी मच, राइट, लिमिटेड आल्सो, राइट? सो दिस इज द पॉइंट, okay, so it's okay. So now the next thing I'm going to discuss just now, okay, so now the next point is that we are discussing about this, right? So the next step is primary health care is provided by, we are talking about India, right? Primary health care is provided by a network of, in our country, primary health care is provided by a network of, right? Network of what? Right? One is primary health care sub-centers, right? One is, we can say, primary health care sub-centers. Okay. Primary health care sub-centers. Okay. One point is that. Right. Primary health care sub-centers, right? And the second is that, that is, we can say, that is the primary health care center. Primary health care centers, right? So this is there in our system, right, in our country, right? So at the bottom, there are healthcare sub-centers, right? Let me tell you, right? So these are the healthcare sub-centers, 1 sub-center, 2 sub-centers, right? 3 sub-center, 4 sub-centers, let's suppose, right? Whatever can be the number. These are the healthcare sub-centers, right? And then above these primary healthcare sub-centers, right? So there is one primary healthcare center, right? So this is the system, right? So one above them, that is the primary health center, PHC, जिसको हम कह देते हैं primary health center. Okay, so this is the PHSCs, right? PHSCs means primary healthcare sub-centers, right? So above the primary healthcare sub-centers, there is the, you can say, PHC is sitting there. Okay, PHC is sitting there, right? And now what is there, right? So there may be a number of PHCs, right? Let's suppose one PHC is this, and the second PHC is this. Let's suppose, right? This is the second PHC, right? And let's suppose this is the third PHC or so, right? 3, 4, any, right? Any number. Okay. So this is that, right? So now above these, there will be block level, right? Block level or district level, right? We can say, let's base block level hospitals, right? So these are secondary sector में आते हैं ये, right? And then above the block level hospitals, there are the district level hospitals. Okay, above the block level hospitals, there can be the district level hospitals, we can say, right? So above the block level, sorry. Okay, so above the block level hospitals, there can be the district level hospitals there. Okay, so that's there. So this is the point. Okay, so there are the district level hospitals above these. District level hospitals. Okay, and these you can say, these two things, district level and block level hospitals, right? So these fall in the secondary level, and these two primary health centers and primary health sub-centers, these fall in the primary level, right? And then above these, there are the tertiary healthcare system, right? Above these, what is there? There are the medical colleges, right? And super specialties, right? Medical college, postgraduate institutions, right? And super, right? We can say specialties are there. Okay, सुपर जैसे आपका पीजीआई लखनऊ है, right? Super specialties are there. Okay, are there, right? So this comes in the tertiary healthcare. Tertiary healthcare. Okay, so this is the healthcare system in our country, but I am explaining this to you yet, right? So this is to make it simple for you, I have explained it to you. Okay, so what is there, right? So a referral from this primary health center to, sub-center to primary health center to block or district level health center, right? District level health center to referral to further medical colleges and super specialties what are there. Okay, so this is the main structure of the health system in our country. I hope it is clear to you. Okay. So now what is there, right? Now what is there at the primary health sub-center level, right? What is there? There is one, right? There is one, we can say, right? Auxiliary, AUXULIARY, right? Auxiliary means Sahayak assistant, right? Auxiliary, nurse, midwife, right? Auxiliary nurse midwife is there, and plus there is one multi-purpose. Okay, there is one multi-purpose health worker, right? Multi-purpose health worker exists. प्राइमरी हेल्थ सब सेंटर पे कोई डॉक्टर नहीं होता, वहां ऑक्सिलरी नर्स मिडवाइफ and primary health worker is there, right? Is there. Okay, so next, one primary health sub center, right, serves a population of, right, 5,000 in plains. Okay, one primary health sub center, okay, one primary health sub center serves a population of 5,000 in plains and 3,000 in, we can say, hilly region, hilly and tribal area, right? In hilly and tribal area, right? So this is the primary health sub-center approach. Okay, primary health sub-center. This is what we mean by that primary health sub-center now. Okay, so that's the point, and it's important also, primary health sub-center. Right? So now the next thing is that is the primary health center. So as far as the primary health center is concerned, right? So primary health center, we can say after every, right? You can say 5 or 6, right? After every 5 or 6, right? 5 or 6 primary health sub-centers, right? There is one primary health center. There is one primary health center, which is PHC. There is one primary health center. Okay. So one primary health center serves the population of, right? One primary health center, okay, serves the population of right, about 30,000 in plains, and about 20,000 in hilly areas. Okay, about 20,000 in hilly areas. So this is the 20,000 in hilly tribal areas, right? Hilly and tribal areas. So that is there. Okay, so then there is in primary, you can say, health center, there is one medical officer, right? There is one medical officer, and one medical officer exists there. Okay, one medical officer, and plus, right, other paramedical staff. Okay, other paramedical staff, like we can say pharmacist, etc., etc. Other pharmacist, nurse, etc. Right? Other paramedical staff is there. Okay, so this is the primary health center, which is there in our country. And the next point is that is the block level hospital, right? So block level hospital and these district level hospitals, what are there? These comes in the secondary sector, right? These comes in the secondary sector. It means this is the second tier of health system in our country. Second tier of health system in India. Okay, health system in India, right? So here patients come from primary health centers, right? Patients, right? Here patients come on the reference of primary health centers, right? For you can say specialist services for treatment, right? For specialist services, right? So this is about the secondary health system, right? And tertiary health system is the third and the top tier of healthcare system in India, right? This is the third or top tier of healthcare system in India. Okay, healthcare system in India, we can say this is the healthcare system in India, right? So what is there here? Specialized, right? Here specialized, we can say consultation, right? Specialized consultative services. Okay, consultative services. Okay, consultative services are provided on referral basis. Okay, provided on referral basis from the secondary healthcare system, right? Or from the secondary hospitals, whatever is there. Secondary hospitals, right? So these includes medical colleges and research institutions, right? These include medical colleges and research institutions. So that's there. These include medical colleges, okay, and research institution. So this is there. This is about the healthcare system of our country, which is the three-tier healthcare system of India. I hope this is clear to you. Any doubt of anybody up to this point? You can ask, please. Okay. Clear, okay. Clear. Okay. Clear. Okay, great. Good. So now let us move on to the next part. Right, as far as the next part is concerned, in the next part, we are going to discuss about the Alma-Ata Declaration, little bit. Alma-Ata Declaration, because this is very important declaration when we talk about the health systems. Alma-Ata Declaration, right? So we will discuss about that. Okay, so one point about this is that this is the declaration on primary health care. Very much important point, right? एग्जामिनेशन में आप यहाँ गलती करोगे, राइट? अगर ऐसा क्वेश्चन आता है. So this is declaration on primary health care, not on the secondary or tertiary health care. It has nothing to do with that. Okay, so please bear the point in mind. One is that, right? Declaration. Okay. So now the next point there, that is the it was adopted at international conference. It was adopted an international conference of primary health care. International conference on primary health care कर लीजिए, right? On primary health care. On primary health care. Okay, so that's there, right? At we can say, right, Almaty in Kazakhstan. Okay, in Kazakhstan. So that's the point, right? In 1978. Okay, so please bear this in mind that in 1978, Kazakhstan was a part of USSR, right? So if in the examination this is asked that the Alma-Ata Declaration was held in USSR, so that is also correct, right? So Alma-Ata Declaration was held in USSR. That's also correct point. Okay, please don't think that sir ने वहाँ Kazakhstan बोला था इसलिए ये गलत है. No. Okay. So the next thing is that it is measured as a major milestone. It is taken as a, or it's measured as a. So it is taken as a. It is taken as a major milestone. Okay, major milestone we can say of 20th century in the field of public health. Of 20th century in the field of public health. Okay, milestone of 20th century in the field of public health. So that's there. Yes, at that time when the Alma-Ata Declaration was signed in 1978, at that time Kazakhstan was a part of USSR because the disintegration of USSR took place in 1980s, in fact 1990s, right? So that is why at that time Kazakhstan was not existing separately, right? So that was the point. Okay, in the field of public health. Next, it identified, right? Next point है Alma-Ata Declaration identified. It identified. Okay, it identified primary health care. It identified primary health care as the key to the attainment of goal of health for all. Okay, as a key to the attainment of goal of health for all. ये नहीं मुझे मालूम इसको इंडिया से अटेंड करने के लिए कौन गया था, right? So that's the point. So it identified primary health care as the key to the attainment of goal of health for all, right? So that's there. So the next point is that it expressed the need for urgent action by all governments all health and development workers and you can say the world and the world community to protect. World community to protect and promote health for all people. The health for all people. So that's important here again. Okay. So next, in the international conference, this Alma-Ata conference, in the international conference, okay, international conference there, the various countries and international organizations agreed upon a common definition of health. Okay, common definition of health that examined right causes of ill health, and life beyond, okay, and life beyond the four walls of the hospital, right? So this is important thing. Okay, health की definition इन्होंने क्या ली, right? So now on the next slide, I am moving on to the next slide where we will discuss that what is health according to the Alma-Ata Declaration. Okay, what is health according to the Alma-Ata Declaration? Is this slide done? Have you noted it down? Tell me. Okay, done. Okay, right. So moving on to the next slide now. Okay. So is it done? Okay, so next slide now. As far as the this concerned, right? So on this slide, we will do what is health according to the Alma-Ata Declaration. What is health according to the Alma-Ata Declaration? Alma-Ata Declaration, right? What is health according to that? Okay, so number one, we can say, let us write it otherwise. Health is a state of complete physical, right? Complete physical, mental, and social well-being, right? And social well-being, and not mere okay, absence of physical disease. Okay, so that means Alma-Ata Declaration recognized the three aspects of the health. One is the physical aspect of the health. Second is the mental aspect of the health. Third is the social aspect of the health, means your social status, your social, right, recognition. All these things are part of the good health. Okay, so that's there. Okay, so social well-being, right, and not mere absence of disease, right? So now the declaration, next line, the declaration okay, the declaration recognized recognize health as a human right. Recognized health as a human right. So this is also important. Right? Health as a human rights. Right. So it means Alma-Ata Declaration says that health is a human right. One thing is that, and second, Alma-Ata Declaration talks about the three domains of health: physical domain, mental domain, and the social domain. And then it talks about that health is a human right. Right. Next, इसी declaration में कहा गया है कि to attain good health. Right. इसी declaration में है to attain good health. Right. To attain good health, it's there. Okay. Good health. So several social and to attain good health, several social and economic sectors, right? Several social and economic sector in addition to, right? Health sector. In addition to health sector needs to be involved, right? Needs to be involved. So the point is that for good health, it is not only health sector's job, right? The other various social and economic sectors should also be involved in that. Health is not a fundamental human right, but yes, it is implied in right to life. Okay. So that's there. To attain good health, several social and economic sectors in addition to health sector needs to be involved, right? So that is the point here, right? Those needs to be involved there. Okay. So that's the point, right? So this is there. The next point is that health and wellness centers, right? The next point is health and wellness centers. Okay, health and wellness centers, right? So we can say that health and wellness center means, first of all, there are two, right? There are two components of Ayushman Bharat scheme. Ayushman Bharat scheme, right? So name of the scheme of the government of India, Ayushman Bharat scheme, right? So Ayushman Bharat scheme has one component, that is the health and wellness centers. One component of the scheme is that is the health and wellness centers. One component scheme, health and wellness centers. Okay. And the other component scheme is that is the PM Jan Arogya Yojana. Right. PM Jan Arogya Yojana. Okay. So these are the two components of that scheme. Jan Arogya Yojana. Right. These are two components of the scheme. Okay. So as far as the two components of the scheme, this is named to the scheme, right? So as far as the two components of the scheme is concerned, right, their aim is to, first of all, as far as health and wellness center is concerned, right, the aim, government's aim is to establish 150,000 health and wellness centers. Government's aim is to establish 150,000 health and wellness centers right? The purpose is to deliver is to deliver comprehensive health care, okay, that is universal and free, okay, so that's there, that is universal and free, right? So this is there, that's universal and free to users with a focus on, right, with a focus on, we can say, wellness and delivery of an expanded range of services, okay, of an expanded range of services, right, closer to the community, right, means लोगों तक सर्विस लेके जाना, closer to the community, right, to open the health and wellness centers, right? So that is the point, okay, right? So that is the point there. I hope this point is clear to you, right? So this is the, so one is to open the health and wellness centers, 1,50,000. Yes, 10 is required there. That's wrong here. Okay, we need one more zero here. 1,50,000 health and wellness centers are to open. Right. So this is the point. This is about the health and wellness centers. Right. So the next thing which we were about to discuss, that is the One Health. Right. Right. One Health concept. That is there. One Health, One Institution concept. Right. So let me tell you in brief that what is there One Health, One Institution concept. This is very much important concept according to the One Health, One Institution concept. Right. Is that human health is not isolated. Human health cannot be independent of the environment around him. Right. Human health cannot be independent of the environment around him, right? So if in a particular environment, okay, the population of the, let's suppose, other living beings is reduced, decreased, or decreases due to any reason, then that will indicate the loss of the human health also, due to various factors, right? So it means what is there? One Health, One Institution scheme, right? Means you can say that health is a collaborative, multi-sectoral and transdisciplinary approach. One is the collaborative approach. Second is multi-sectoral approach. Right, so health does not mean my health only, right? Health means my environment also. If I am not having the good environment, clean environment, healthy environment, then I cannot remain healthy. So it means health does not mean, right, okay, I got fever, I got chest congestion, I go to the hospital, they give me injection, right? And I start feeling, right, ease in breathing. So that's not health basically, right? Health is what? Health is a multi-sectoral approach and a collaborative approach which has a relation with your outside environment, which has a relation with a number of factors there. Okay. So if you are not having the employment, you will be under stress. right? You will be in depression, right? So whatever medicines they may give you, but until and unless you are given the employment, right? So you cannot come out of that depression. You cannot come out of that state of mind. So that is why health is not an isolated or independent discipline which can be separated from your environment or from the other things around you. Is this point clear? Health is that point, right? One is that, right? So, and transdisciplinary approach. So it means health is not related to one sector only, that is only the health sector, right? So it has association, it has roads into the other disciplines as well, right? So now you can say, right? So health uh, is a function of those disciplines also which work on the local level, which work on the national level, and which work on the global level as well, right? So health is a function of those disciplines which work on local level, which work on global level, or which work on the national level also, right? It means, right? It means let us see that, right? Outbreak of COVID-19 in Wuhan city of China, right? So that affected India as well. That affected America as well. That affected the entire world there. One point is that. Okay. Okay. So if some disease outbreaks in Africa, right, in the wild of Africa, let's suppose, right, in the forests of Africa, so that disease may anyway enter into India as well. How? Because today we have trade relations with that country, with those African countries also, right? So from there, right, through the various products, through the various forest produce which is exported to India, that disease may thrive India as well. Okay, so this is the thing, right? So, and moreover, if at local level we can say, right? So if the, right, if the forest nearby you, right, if the forest nearby you, right, has some animals, right, if the forest nearby you, we can say, right, have some animals which have been affected by a particular disease, right? So when you will come in contact with those animals, right, through either directly or through some other medium, so that disease may shift to you also. So that is why health cannot be cut off, right? Health cannot be seen as independent from the other disciplines, from the other sectors, right? From the other, you can say, environment which is around you, right? So this is the fundamental behind the concept of this one health, okay, one institution concept, right? So which I have talked just before that, right? So now that is there, okay. So to achieve the optimal health of the human beings, okay, to achieve the optimal means best, right? To achieve the optimal health of the human beings, right? What is required there, right? We need to recognize the interconnection between the people, animal, and plant, right? We need to recognize the interconnection between the people, animal, and plant. Very much important thing, right? Because people depend on plants, people depend on animals, animals depend on plants, right? So that is why, right? If you can say in any of the sectors there is problem, right? So you will be in trouble, right? If in any of the sectors there is problem, you may also become in trouble, right? Like we can say, it is said that the outbreak of COVID, right, was from what? What led to the outbreak of COVID? It is said that there is the right that meat market in Wuhan, right? So from where this has spreaded, you can say, right? So now it means we can say, right, bats, right? So it means the right virus in bats affected the human beings further. So animals को separate करके नहीं देख सकते हम human being से in this particular respect. Okay, so in many cases animals become the reservoirs of a number of viruses, right, and some other, you can say, pathogens, right, so which are carried by those reservoirs, by those animals, right, to you. Okay, so that is the important concept, that is the important thing here, right? So it means that because we are living in the shared environment means we people share the environment with animals, we people share the environment with the plants, plants share the environment with us, right? Right? Animals share the environment with us. When we are living in shared environment, right? So whatever may be the right effect on the health of one, that may cause effect on the health of the other as well, right? Because we are living in a shared environment. Okay, so that is there, right? So then the need is felt that right, the need is felt that you can say there should be an you can say interdisciplinary approach which is required to be followed to promote the human health, right? Interdisciplinary approach which is required to be followed to promote the human health, right? So in this background, okay, in this background, India got first of its kind, you can write it that way. India gets first of its kind, National Institute of One Health, NIOH, right? National Institute of One Health, right, which is being established at Nagpur. Okay, which is being established at Nagpur, right? So please bear this in mind. Examination में ये बहुत probable question है. Question can be asked that what do you mean by one health, right? So please don't consider that one health means physical health, mental health, and the social health of a human, right? Please don't consider that, right? So one health concept means when we live in the shared environment with the animals and the plants, right? So then we can say that shared environment needs to be healthy, right? Right, so that the plants there and the animals there and the human beings there may remain healthy, right? So problem in any one component of that shared environment, that may affect the others as well. So that is what we mean by the one health here, right? Okay, so the National Institute of One Health at Nagpur is being established in collaboration with National Institute of One Health at Nagpur is being established or being established in collaboration with number one, Indian Council of Medical Research, in collaboration with Indian Council of Medical Research, that means ICMR, okay, medical research, that is ICMR. And number two, Number two, right? Number two, Telankhedi, sorry, Telanghedi, right? Telankhedi, based Maharashtra Animal and Fishery Sciences University. Maharashtra Animal and Fishery Sciences University. Okay, so it is being brought by that. Okay, Maharashtra Animal and Fishery, right, Sciences University. So it means a National Institute of One Health Sea, right? So it has the collaboration of the means Human Health Organization, and second is the Animal Health Organization as well, right? So this is what we mean by the concept of One Health. Is it clear? Is it clear? Anything, any problem of anybody, please let me know. Right, it should be clear to all of you. Okay. Don't go home with any doubts. Okay. So now let us move further on to the next one little point. Not much time I will take of you. That is why I have started discussing it, so that the topic should be finished instead of writing. I'm doing that now. Next is the National Institute of Virology. National Institute of Virology, VIROLOGY. Virology. Okay. This is number one. इसको NIV भी कहते हैं. This is known as NIV, National Institute of Virology. So it is based in Pune, in Maharashtra. One point. And second is it is designated as WHO, World Health Organization reference laboratory, WHO reference laboratory for Southeast Asia region, so that's there. And the third point is that the institute was established in 1952. It was established in 1952, right? And the next important, and the next point which I'm going to tell you now, that is very much important point. And what is that point? That point is that NIV means National Institute of Virology is serving as a national monitoring center for what? Number one, influenza. And number two, what is that? Japanese encephalitis. Right, this is name of a disease. Okay, Japanese encephalitis, ENCEPHALITIS, right? Japanese encephalitis. Okay, so Japanese encephalitis, okay, is a virus, is caused by a virus, right? Which is you can say, which is transmitted to human beings by mosquito, right? To human beings by mosquito. right? Mosquito, and in and it can cause right encephalitis, Encephalitis. It can cause encephalitis. Encephalitis क्या होता है? What is this? This is inflammation of brain, right? दिमाग की सोजिश, right? This is called the inflammation of a brain. Okay, inflammation of brain, which may lead to death even, right? Inflammation of brain. Okay, so this is there. So it is a national monitoring center for, we were writing, number 1, influenza, number 2, Japanese encephalitis, and number 3, rotavirus. Rota, इसको short में rota लिख देते हैं, ROTA. Rota is an infection caused by rotavirus, right? Rotavirus. Okay, rotavirus. And the next thing is that measles, 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 right? So measles is called by pyramoxyvirus. Measles, MEASLES, measles is caused by, okay, MEASLES, measles is caused by pyramoxyvirus. Okay, pyramoxyvirus. So this is that measles is caused by this. Okay. Pyramoxyvirus. So that's there. Okay. So next is hepatitis. Hepatitis, HEPATITIS, hepatitis. And the next is coronavirus. Coronavirus. Right. So this is very much important that in India, which among the following is the National Monitoring Center of Coronavirus in these days? Because this is a hot topic, right? So we have heard about the reasons behind the coronavirus. We have heard about the vaccines of the coronavirus, right? We have heard about the origin of the coronavirus, right? We have heard about other things about coronavirus, but the question can be asked that which among the following institution has been, has been authorized as or has been appointed as the National Monitoring Center of Coronavirus in India. Okay, coronavirus in India. What should be spelled? Corona, CORONA, that is coronavirus. Okay, coronavirus. And now what is there? Second is, I have spoken about the hepatitis, HEPATITIS, that is the hepatitis. So this is the, so it means please bear this in mind that National Institute of Virology, which is based at Pune, that is a national monitoring center for the following diseases, right? So one is influenza, second is Japanese encephalitis, third is rotavirus, right? This related disease, and fourth is measles, fifth is hepatitis, and sixth is coronavirus, right? Coronavirus, right? And the next thing is that you must have heard the name of a vaccine today in these days, that is a Covaxin, right? So Covaxin is also an anti-coronavirus vaccine which has been developed by NIV, National Institute of Virology, Pune, right? National Institute of Virology, Pune. वो भी इन्होंने develop की है. Okay, they have developed this, right? So now the last brief thing, that is the National Center for Disease Control. National Center for Disease Control, very much short में लिखेंगे हम, right? So National Center for Disease Control, right, is an institute under the directorate of, is an institute under the directorate of, health sciences, Ministry of Health and Family, under the health sciences, Ministry of Health and Family, right? So please bear this in mind. National Center for Disease Control is not an autonomous institution. Question ऐसे पूछते हैं, right? It is not a statutory body, right? Yes, it is a normal institute which functions under the Directorate General of Health Sciences in the Ministry of this Health and Family Welfare, right? Second point is that it was established in 1963. इसको 1963 में establish किया गया था. It was established in 1963. Okay, for research in right, that is the epidemiology, EPIDEMOLOGY, right, for research in the epidemiology. Epidemiology, what is that? Right, epidemiology is a science, is a subject which deals with the control of diseases, right, which deals with control of diseases. So its purpose was to do research on such areas, right, which may help in control of diseases in the country, right? Research in, we can say, epidemiology, and then control of, right, epidemiology. Sorry, यहाँ पे E करना है, domology लिख दिया ना, यहाँ पे E करना, epidemiology, right? And the next thing is that and control of communicable diseases. Communicable diseases are those diseases which spread from person to person, right? Communicable diseases, and to reorganize activities, of Malaria Institute of India, to reorganize activities of Malaria Institute of India, right? The headquarters of National Center for Disease Control are at New Delhi. The headquarters of National Center for Disease Control are at New Delhi. And the center advises the government. Center advises the government on public health. Means this Center for Disease Control, National Center for Disease Control, it advises the government for, right, or on the issue of public health. Public health के issue पे guide करता है, क्योंकि ये एक research institute है. So in today's lecture, we have discussed a number of important things, right? So among those number of important things we discussed, first thing we discussed that Prime Minister Atmanirbhar Swasth Bharat Yojana, launched in the budget of 2021-22, right? 6-year plan, right? Its purpose is to improve the healthcare system of the country. That's there. Okay. And it is a 6-year plan. That's there. It is a centrally sponsored, central sector scheme. That's there. Right. So its purpose is, one is to strengthen the primary, secondary, and the tertiary healthcare system in India. And number 2, strengthening of the national institutions or in health sector in India. And number 3, establishment of the new institutions, keeping in mind the this new diseases and the threats emerging from those. So that is the point there, which we discussed in this thing, right? And the next important thing which we discussed in this today's lecture, that was the important features of the scheme. That is introduction of the, strengthening of the health and wellness centers throughout the country, right? Opening new health and wellness centers, 150,000 approximately, that is the target of the government. And then integrated public health labs, and then critical healthcare hospital blocks to build. And then what is there? National Institution for One Health that needs to be established, right? National Institution for One Health. And next we discussed that what is the difference between the central sector scheme and the central schemes. These two things we discussed. Then we discussed that what is the primary health, what is the secondary health, and what is the tertiary health. What is the meaning of the primary health, what is included in that. Then we discussed about that Alma-Ata Declaration also, right? Alma-Ata Declaration also. And we discussed in detail about that, right? And then after that, you can say Alma-Ata Declaration, right? We discussed about the, you can say, health and wellness centers also. Then next to health and wellness centers, right? We discussed this National Institute of One Health as well, right? Then apart from the National Health Institution of One Health, then we discussed National Institute of Virology. Important things about virology was that where it is located, which this coronavirus vaccine was produced by it, developed by it. Second thing, and the third important point is it has been designated as National Monitoring Center for Control of Diseases. Which diseases are those? Right, here's some diseases we have talked about. So it is a National Monitoring Center for Control of all those diseases. And then we discussed about the National Center for Disease Control, right? So National Center for Disease Control is an institution under the Ministry of Health, the purpose of which is to do research, right, on the, we can say, epidemiology. Epidemiology means how to control the, we can say, diseases, and how to control the communicable diseases in particular, right? So that is there, right? So I think today's lecture is, from my end, today's lecture is over, and now you are done. Okay, Delhi, National Center for Disease Control, Delhi, New Delhi, right? Rizwana, is it clear? I told you it is Delhi. Have you noted it down? So now, anything else you want to ask? Right. So, as compared to geography, was it boring? Or geography is more boring? Tell me. Okay, how did you like today's lecture? Please tell me. Okay, no boring. Right? Okay, both are good. Okay. Full of information, interesting. Okay. Right, always. Okay. Right. Okay. I'm showing you that slide. Okay, not problem. Right. Okay, beta, at secondary level, beta, there is a lot of staff, right? Secondary level, there are many doctors, right? There are laboratories also, there are the X-ray units also, right? There are the operation theaters also, right? And there is paramedical staff as well, right? Nursing staff, paramedical staff, and many doctors with different specializations to exist. Okay, so that's there. I'm just showing this slide about that. Oh, which slide? Central scheme and that. This is the slide. Better today, due to that book which is I am working on, right, which I am sending for printing in 1-2 days. So that's why today I may not be able to take your 4 p.m. class, right? So that class will I take on Monday. So by then you please do your exercise. Have you done with your exercise or not? Or is it still pending? The assignment which I gave yesterday for that on that average questions, no? Have you done with that or not yet? Okay, pending. Okay, right, no problem. You complete it. Okay, so no problem. And whatever the problems will be there, you bring those problems to me. Okay, not an issue. Doing. Okay, right. Sudhanshu, that was on CSAT yesterday I gave. Okay, beta. So anything else to say? Can I take leave now? Can I take leave? Anything? Okay.
Sure, sir.
Take care. We will meet on Monday now. Okay.
Thank you, sir.
By then.
Thank you so much.
Okay, beta. In between.
Thank you, sir. Good noon, sir.
Pardon? Hello.
Good noon, sir. Good noon, sir.
Okay. Good noon. Right. So, beta, in between, right? If anybody needs to contact me, you can contact me anytime. Not an issue. Right. So if I will be free, I will take your call immediately. Right. If not free, then I will call you back. Right. So right. But in that case, please leave me a message, because sometimes a phone number may not be, you can say, right there in my contact list. So sometimes problem hota hai. So that's why if I fail to attend your call, then kindly drop me a message writing your name. Right. Okay. So then automatically I will call back to you. Okay. So not an issue, right? So we are a family. Stay happy, right? So stay connected. Okay. So focus on your work, right? And keep a balance between your right enjoyment and work. Both are required in that phase of life which you are passing through, but keep balance between the two. Okay. So, right, we will meet on Monday now.